Karen McManus, Director of Demand Generation for WebMD Health Services. Thanks for joining us for today's webinar, Integrating Health Coaching into a Global Wellness Strategy. Today's session is a listen-only event, but please feel free to submit any questions you may have online throughout the presentation, and we'll address those during a Q&A period at the end. Also, although we will not be distributing the deck from today's webinar, we will be sending all attendees an email with a link to a recorded archive shortly after the event. Today's session is being presented by Carol Simpkins, Clinical Services Manager for vielife, and by Catherine McPherson, Senior Director of Product Strategy for WebMD Health Services. Carol is responsible for vielife's international health coaching solution and for managing service delivery across the globe. She has extensive experience in designing, developing, and implementing clinical services telephonically and face-to-face, and she is also a qualified counselor, supervisor, and coach. Kat McPherson focuses on product strategy for telephonic, online, and on-site behavior change programs, including health coaching at WebMD Health Services. She is a registered dietitian and has worked in the health and wellness field for more than 15 years. Before joining WebMD, Catherine managed a portfolio of health and wellness products for another health services provider. Addressing one of the nation's largest health issues, Catherine also oversaw all aspects of the Weight Control Information Network and Obesity Information Clearinghouse and Call Center from the National Institute of Diabetes, Digestive, and Kidney Diseases, part of the National Institutes of Health. So today we'll be taking a look at some of the drivers and challenges related to global wellness in general and the emergence of coaching as part of an international health management strategy. We'll discuss how to best integrate a coaching solution into a global wellness program, and then, as mentioned, we will have a question and answer period towards the end. Before we start, I'll provide a brief introduction and overview of the company that's bringing you today's webinar, WebMD Health Services. We're a part of WebMD Corporation, which has three primary areas, including WebMD.com, the #1 source of health information on the web. WebMD also reaches the provider population through Medscape, a top online destination for physicians and a leading provider of CME programs. And then WebMD Health Services is one of the largest health and wellness solution providers in the U.S. WebMD Health Services offers profile-driven health management solutions in the areas of behavior change, consumer guidance, lifestyle and condition management, on-site services, engagement services, health management consulting, and reporting, analytics, and research. And all WebMD solutions are geared toward providing personal guidance that brings about positive change in health behaviors and outcomes. And with that, I will now turn things over to Carol Simpkins of vielife.
So who is vielife? vielife is a provider of global health and wellbeing solutions, and we're actually based in London in the UK. We're owned by Cigna in the US, and our solutions engage clients around the world to make positive lifestyle changes which will have an impact on their overall health and well-being. You will see from the slide that we enable individuals to assess, individual reporting, provide focused targeted improvements for individuals, and encourage reassessment. We're a range of online and offline programs which include online health and wellbeing assessment programs, targeted risk assessments, and lifestyle management programs. Offline, we offer telephonic health coaching and employee assistance program services. We also offer paper health and wellbeing risk assessments, and we offer on-site biometric screening services. Our products are multilingual, and we currently have 26 localized versions of our online solution and are able to offer offline solutions in the same number of languages. Some key components are that we offer reporting which is personalized for the individual, we offer a customizable solution, and we provide aggregate reporting for the client, as well as individuals having personal detailed reports and recommendations. So a little bit of a backdrop to global wellness. Many of you will be aware global wellness is a growing concern for multinational corporations. And in a recent Towers Watson survey, 75% of respondents expect it to be more of a priority for their organisation in the coming year, and 7% expect it to be more of a priority in the years ahead, 2013 to 15. If you look at the slide and look at the diagram on the right, you'll see that 32% of multinational corporations currently do have a global workforce health strategy in place, which is an increase from 26% last year. And we know that 47% plan to adopt one within the next 2 years. Wellness programs are increasingly being offered, and we now know that 3/4 of multinational companies offer these programs, and they've been growing in popularity. So the business drivers for global wellness. Well, we know, according to the World Health Organization, that non-communicable diseases or non-transmittable diseases and non-infectious diseases are now responsible for 63% of global deaths annually. Factors such as an individual's lifestyle and environment are known to increase the likelihood of non-communicable diseases. And the 4 main behavioural risk factors that contribute to this include tobacco use, physical inactivity, harmful alcohol use, and unhealthy diets. If we look at the next slide, we'll see some of the business drivers for global wellness. And as you may know, the common North American health risks are becoming more prevalent worldwide. If you look on the side, you'll see that stress is in lots of the trees. Stress is cited as the top health risk, driving wellness programs in most of the world. Look in Latin America, you'll see that physical activity and exercise is a key concern. And in the past 20 years, obesity rates in Mexico have risen from 10% to 68%. Some quite settling statistics that by 2025, 57.2% of India's population is projected to have diabetes. And trends do continue. By 2030, tobacco will kill more than 8 million people worldwide each year. Of course, wellness objectives vary by region across the globe. In the US, reducing costs tops the list of objectives. Within other regions, this is not the key driver. And again, you can see from the grid with the different territories that for lots of countries, improving productivity, reducing presenteeism, and improving employee morale are top objectives. Lifestyle programs are still emerging internationally, and you can see from the diagram on the right that lifestyle coaching is fairly near the bottom at the moment. But what we know from experience is that international solutions are following a similar adoption pattern to the US. They begin with preventative measures such as screenings and vaccinations, and then lifestyle management programs are following, which cover tobacco cessation, health risk assessments, disease management, lifestyle coaching, and weight management. The challenges across the globe. Care costs are continuing to rise in the US and globally, and increased health risks mean that there's rising demand for very limited resources. Ongoing economic uncertainty in many territories has led to government-sponsored benefits being scaled back in some countries. There are significant regional differences in terms of culture, laws and practices, corporate management and communication styles too. Of course, as a result of that, there are a lack of vendors who offer comprehensive, integrated solutions. Should you consider adding coaching to a global wellness strategy? One-to-one coaching can really help fill gaps in care by providing a holistic approach, looking at the whole person, drive behaviour change and improve critical risk factors. An excellent proactive approach, targeting those people who really need the help, so look at those people who are at high or medium risk. And we do have a multi-channel delivery opportunity which allows participants to choose and engage in the manner they're most comfortable with. So it could be on-site, telephonic, online, video conference, or mobile support. Improving employee health status by encouraged lifestyle changes can have a huge impact on the workplace, particularly by improving performance and productivity, reducing absenteeism and presenteeism, and improving the bottom line. And overall, it would enhance employees' benefits packages and promote companies as an employer of choice. I'm going over now to Catherine so that she can talk about structuring a successful global health coaching program.
Catherine is joining us from an airport, so she is just dialing back in and will be joining us shortly. And Carol, perhaps you get us started with some of the considerations that organizations should have in mind when they are expanding their health coaching program globally.
Hi, Karen. It's Catherine.
Terrific. Hi, Catherine.
There. Okay. So thanks. We're going to move on and talk about expanding the health coach program globally. So first of all, we want to really lay the right foundation. So that means, reviewing overall health management objectives for your company. And you need to ensure that global coaching is going to fit with those goals. So analyzing those is really important. And understanding that objectives might vary by office. So we saw in the data that Carol was presenting, really interesting information that, reducing costs is a top objective in the U.S., for example, but increasing productivity or employee morale higher on the list for other locations. And so understanding, office-specific or country-specific needs is important in your overall objectives. Involvement of key stakeholders is also key. That's where you're going to find out about those office-specific objectives. And it also means that any program that's put into place is completely, bought by the individuals who are going to be participating. That means getting the local HR team members engaged, the local management teams, executives obviously are going to need to back the position, and consulting firms can also help drive this. I also want to mention that at WebMD Health Services, we do have our own health management consulting group that can meet with your company to help you start to develop your global strategy. Planning how and when the coaching program is going to be introduced is important. So what's that rollout plan? If this is something that's been in place in the U.S., how are you starting to deploy this in your global offices? So looking at the different countries, the time frame, the rollout plan, what solutions, when, and where. Also, obviously, understand the languages required as part of your solution. So after you're gathering all these needs, you're putting your foundation together. That's where you're moving into the RFP or procurement process. Starting those conversations, starting to take a look at getting this all down on paper and determining what solution is going to meet your needs. Also, what's important, we all know that wellness programs, especially health coaches, because it is a one-on-one conversation that's occurring, is really a key driver of referrals. And so making sure that there are points between other in-country resources that are available is going to be key. So things like EAP available in that country, biometric screening events that might be going on, but also local resources like gyms and other fitness or dietary resources. So after the RFP process, mapping out your solution, once you determined your solution, the next component really is around communication. Communication is the key to any successful program, that's domestically or globally. However, this can be a way to really unify your message and your program across countries you're operating. The solutions may vary based on country, but the overall branding, the overall message can really be unifying. Something to consider would be global and local brand guidelines, making sure those are understood, and everyone producing materials is adhering to those guidelines. Although branding can be the same, content is going to vary because you want to make sure your content is localized. So understanding the cultural expectations, backgrounds of the readers, making that information relevant to those individuals that will be the audience is important. Some things to consider as you're looking at your country-specific communication strategies would be, how are you going to leverage champions in that area? Is that an individual who can help you get the message out? So understanding, the who is important, as well as the how, what channels are available to you. Is this going to be electronic communications? Is it going to be worksite-based communications, more, traditional formats like posters, etc.? And then understanding incentives and how those are going to play into the communications. But, we'll hear some additional statistics about the role of incentives and how those vary around the globe by region. Okay, so now you've got your determined solution, you've got your communications program, so you're going to launch your program. It's always important to review that launch, obviously. What worked for you, what worked for the company, and what can be improved next time. So, often what we see in any kind of wellness strategy, domestic and global, is a phased approach. So that phased approach, is essential because it can really help you build on what you've learned in a rollout phase and improve upon for subsequent phases. So feedback is really important. Determining your benchmarks so you can measure against them in subsequent years is important. Putting out, delivering the results to those who have backed the solution that you've put into place, and communicating broadly the success that you've delivered is important. And although management executives will want to see data, what resonates with a lot of employees and can also help drive engagement are more of the personal stories. So testimonials and success stories are really important for sharing your message. Updating your plan, so adjusting program components, benchmarks as needed, and then planning regular sessions to keep communications and momentum going in your program. So now I'm going to get into the solution. So talking about the health coaching solutions that WebMD and vielife offer and how they're truly unified in their approach. So our organizations in presenting our health coaching, again, take a very similar approach, and that starts with, the one-on-one coaching delivery. We taking a broad approach where we're addressing all factors in a whole person approach to change. And so a health coach is working with an individual on the different risk factors they have. That could be women, nutrition, exercise, tobacco, sleep, etc. But we use a multi-channel platform, so communications are occurring not only telephonically, there are wraparound communications, and also online sources that are available. Both our organizations really hard to provide high engagement rates in the program. Talk about that a little more. So I'll stop for a minute and talk about this whole person approach to change and the significance of that. So, instead of bucketed coaching programs where you're working with one coach in one program on one of these risk factors, when you're working with one individual on all the factors that you have as a participant, brings real-world relevance. One healthy habit is going to drive another, and we understand that from our own coaching program. So at WebMD, we did an analysis of more than 100,000 of our coaching participants, and we learned that those who moved from being sedentary to doing 90 minutes or more of physical activity a week were actually 60% more likely to quit smoking, to develop that self-efficacy, and to healthy habits in our areas. Another point where our coaching programs converge is around the enrollment. So both WebMD and vielife approach to health coaching is that it's important to offer this program to individuals regardless of their readiness to change. So we're using the trans-theoretical model to ask participants, where they'd like to start first. Are they ready to make a change in an area? And although it's great for our health coaches to have that information and understand the technique they're going to use in their coaching, it's important to also not gate the program based on that support information. And again, another analysis of our coaching programs showed us that individuals who said they weren't ready to make a change and were both achieving success in the health coaching program. And we know that health coaching is one of the ways that we can actually bring employees along and get them ready to change. So next, about some outcomes. For U.S.-based programs, we know that this is the top driver, that reducing medical costs is key. And so we do offer strong outcomes around participation, health improvement, and financial return of our domestic programs. And, in the upfront portion we were talking about, preparing for a global rollout, it will be determining those metrics that are important to report out management and executives at different locations. And so return on investment may be very important for those executives in U.S. offices, but talking about productivity, presenteeism, and employee morale measures are going to be important globally. I'm going to continue talking about how our programs offer a wide approach to a global population by talking really about the protocols that go in the telephonic coaching program. So both are a 12-month program, and that length of time is really optimal to keep somebody engaged in, the time between when they're in their HRA and learning about risks. So it allows individuals to work on more than an area of change and adopt a change and also maintain that over time. And so calls are made to those identified individuals, and we work with you to determine the level of support you want to provide to a population, be that, high-risk individuals, medium-risk, even low-risk individuals. So the health coaching with vielife is delivered in local language at local times. You're working with a health coach that's in-country, has a, key understanding of guidelines in that country, recommendations, obviously culturally appropriate suggestions. I mentioned both our programs are taking this whole person approach. We're focusing on those key lifestyle risks. Coaches everywhere are going to develop a supportive working relationship, really develop rapport, and this is one of those factors that can drive engagement and behavior change in the program. So typically, always on the first call in both coaching programs, there's an HRA review. And so ensuring that the individual understands the results from the health risk assessment and, all the questions are answered and understanding what's at risk, to the long-term health, and looking at ways to start setting goals and making change in that area. Besides that, all calls in WebMD and vielife coaching programs always come from a health coach. So there's no call coordinators or other resources who are reaching out or speaking with your employees. We're offering reporting. Core reporting is going to identify those key metrics of behavior, engagement, etc. And also emphasize that global data from coaching calls stored in the UK. So where are health coaches? So let's first about who they are, and coach backgrounds can vary. We know globally there's not one definition nor credentialing body for health coaches. Country by country, those vary, and there are certification requirements in different countries. So for example, in Germany, the coaches are all nurses, and they have an in-country recognized coaching qualification. And before that, all coaches are located in-country, and those that are currently available you can see here. So Australia, Brazil, Canada, China, France, Germany, India, Ireland, Netherlands, Portugal, Spain, Switzerland, and the UK, and several countries are coming soon. We'd also love to hear from you about, where the global population is located, and so we can, start to strategize together and determine, where next to deliver. I'm going to turn things now back over to Carol. Thank you.
Thanks, Catherine. And as Catherine mentioned, I think often it's really helpful to hear someone's experiences. It makes the whole program feel a lot more live. So we're going to meet Sanjay, whose details have been changed to protect his confidentiality. And Sanjay is actually still currently in coaching, so we're just giving a snapshot of where he is so far. But Sanjay, he's a 42-year-old father of two. He works in Bombay in India, works in a demanding executive position. And he's not really given much thought to his health and well-being so far. However, he's a young family and he has a young family and he's struggling to maintain his work-life balance. Health has become a little bit more of a priority for him recently because there's been some family member who's become unwell with heart problems, and it's got him to start thinking about his own health. And far, he's not made exercise or healthy eating a priority. So we're going to follow his coaching journey and see the changes that he has made so far. Sorry, I'm seeming to have trouble to moving on the slides at the moment. So now we're going to look at what happens first of all. So for Sanjay, he decides to take his online health and well-being assessment. And when he takes his assessments online, he receives a score of 30, which places him in the high-risk category. And you can see in the screenshot that there's a summary that he's received of his health and well-being assessment, and he'll be able to go to a more personalised report, which will give him more information. When he goes through to the report, he learns that he's at risk for stress, nutrition, exercise. After taking his health and well-being assessment, he receives an outreach call from a health coach who explains the benefits of the coaching program. And what we're finding is that across the globe, in lots of countries, coaching is not a well-known product. So we have to take quite a bit of time to explain to people what the program means. And Sanjay is actually very enthusiastic about the product, and he believes that coaching may provide the motivation he needs to help him make some healthy lifestyle changes. So once he's had the outreach call with the coach, they make a time to call to have the first assessment call. And during the first assessment call, Sanjay meets Manjari, who is his Bangalore-based health coach, and will be supporting him through his coaching journey. So they look at his health and well-being assessment, and on the slide you'll see the report that you can see at the bottom, which gives a summary there of the areas that will be really helpful for him to focus on. And that's indicating that for Sanjay, it's nutrition, physical activity and stress. And they talk about what Sanjay's long-term goals may be, as well as spending some time thinking about what his short-term goals may be. When they complete a meal tracker together, they discover that Sanjay eats lots of fruits and vegetables, but he's relied too much on deep frying. He eats a lot of chapati and dosa, which are made with refined flour. And a key thing is that he travels a lot for work and feels very uncomfortable making healthy choices at business dinners when clients are not doing the same as he is. Just the same initial call, they'll discuss also other resources that may be helpful for Sanjay. And you'll see on the side that there's a shot of a targeted risk assessment for nutrition, which has been localized for India, which Manjari suggests may be really helpful for Sanjay to take before they have their next coaching call. There's also a range of articles online, library articles online, that Manjari refers Sanjay to as well. And they think about specific goals that they can set. And some of the goals that they set in this call is reducing the amount of food that Sanjay fries, as well as reducing the amount of ghee, a type of butter that he uses. At the end of the call, they will schedule the next call with the coach. And there may be in between the coaching sessions emails and information that Manjari will send to Sanjay so that he's got that information to hand. You know that we've moved on several weeks now and that we're on day 37, and during Sanjay's follow-up call with his coach Manjari, they review the goals that have been set, look at any barriers that have got in the way, and see whether the goals that he'd already set need to be reviewed, and see how he got on with his targeted risk assessment for nutrition and whether he'd managed to read the library articles. See in the slide that there's a snapshot of a health coaching journal which Sanjay has also used to help him follow his progress.
Carol, to interrupt, could you speak up just a little bit?
Yeah, sure. Is that a bit better?
Yeah, thank you.
Maybe better. So throughout the year, Sanjay will be followed by Manjari, his coach, and when we were coming to work on the presentation and the slides, Sanjay was just at the midpoint of his coaching session, and some of the goals that he has achieved is that now he's eating breakfast every day, reduced the amount of bread that he eats and is frying less food, and due to these healthy changes he's lost 5 pounds already. So this has been great for Sanjay's motivation, and Manjari has been really encouraging and motivating Sanjay to achieve his goals and checking in with him that the goals are appropriate and relevant for where he is at this stage. One of the things that Sanjay still wants to work on is how he can improve healthy eating when he's away from home, and they discuss strategies about how he may be able to introduce that without feeling that he's letting down his colleagues or not doing what's socially acceptable. The goal that he's incorporated is increasing his physical activity, and one of those that he's doing is walking during his lunch break. Through the coaching program, the coach will encourage the coaching participant to reassess, to take their health and wellbeing assessment again when they feel they've made some improvements. And so Sanjay will be encouraged to do that at the end of the year of his coaching. So I think the key themes to say is that the global coaching program provides a very holistic approach in a local language with local coaches that really will then help the individual to make positive, lasting lifestyle changes, and that we're able to link in with a whole range of resources that have also been localized and made relevant to the particular country and territory. That's given you a snapshot of how the coaching program actually works. And there's going to be a time for some questions and answers now, so I'm going to hand you over to Karen to facilitate that.
Thank you, Carol. We've got a number of questions online, so we'll start with those, but please feel free to continue to submit questions as we talk. First question is for Catherine. Can you talk to how do you make sure nutrition advice is both accurate and able to be personalized? For example, nurses may not have a deep understanding of the subject. Can you speak to that?
Absolutely. With an article, an excellent resource.
Catherine, breaking up for me a little bit.
Besides, the key idea cross-coaching teams, and so there's a resource recommendation that's needed by an individual with certain expertise. We can ensure that maybe comes from the kind of example we in Germany prior to a nursing background. Nutrition plays a component of that training, you're right, but somebody who has that deep expertise is an excellent source. So, ensuring that we've got the appropriate referrals in place if the primary health coach cannot address a specific issue based on education and training is going to be key for any program. Thanks.
Great, thanks, Catherine. Next question is for Carol. Carol, you mentioned that coaching often isn't a known product with some of the organizations that you're working with. How do you communicate the benefits to people? What do you tell them about health coaching?
Yes, I think we do a range of things. We communicate initially with communication material about what health coaching is about, and as well as that, we will, in the actual client organisation, encourage to have some health champions that will also know information about what health coaching actually means. And I think it's really just taking time during that initial outreach call with an employee, answering their questions, taking time to understand what situation they're in. Often we get questions about, is this confidential? Will this go back to my employer? So we have to reassure the individual that this personal information will not be shared. We'll have to sometimes educate the individual that the coach isn't actually going to tell them what to do, but that whether they're mutually going to agree what the goals are going to be and also what things it might be they're able to do to make their own sort of lifestyle changes. So it's being very patient and taking time to explore and explain the product, as well as banishing any expectations that doesn't mean that coaching fits with. So I hope that made sense.
Carol. Catherine, a couple of questions about process. Question as to whether coaches use motivational interviewing and whether the health coach is the same for each call. Can you speak to that?
Absolutely, and I can also ask Carol to weigh in as well, but absolutely, coaches all receive training on motivational interviewing. It's part of their scoring when we look at call quality. So that's an essential tool. Coaches need to ask the right questions. They need to be keen listeners. They need to reflect back, what they've heard from participants and, bring individuals along until they get to that aha moment when they say, you're right. I hadn't thought about it that way, but it sounds like that's what I'm saying. That technique is crucial. It's a key part of our training.
Sorry.
And another part of that question was, is the health coach the same for each call?
Oh, yeah. So, sure, I can answer from the WebMD perspective. And the health coach, we do, strive to provide coach continuity. So the answer is yes. When an individual finishes a call with a health coach, that coach is going to reschedule for the next session with him or herself. So if the employee is available at the scheduled time, it's going to be with the same health coach, but we know that does always occur. So if an employee has to call back in, we'll reschedule for a time when that health coach had a predetermined appointment or, is not working during those hours. Then they may talk with somebody else on an employer team. However, we strive to make sure that we do keep that coach and employee relationship going. There's always the option that if, there is a conversation occurring with another coach that employee could say, I really want to talk with my coach, Sarah. She was really helping me along with something. So we can always reschedule with that health coach. So I know they strive for coach continuity at vielife as well, so I'll let Carol address that.
Yes, to confirm, Catherine, that's the model that we use in vielife globally, that it is the same coach throughout the coaching program, because I think part of it is building the relationship with the individual and showing the successes and maybe the difficulties and the struggles. So I think it's really important that the same coach supports the individual. And also with regards to motivational interviewing, again, that's the model that we use globally too, and reiterate the point that Catherine raised on that.
And I could add one more point.
Sure thing.
So I just want to point out as well that understand why it's really solutions.
And kind of cut out a bit for me there. I'm not sure if others are able to hear you better.
No, I didn't hear Catherine then.
We may be losing Catherine momentarily. We do have a couple of follow-up questions about the coaching process that, Carol, perhaps you could address.
Yes.
Some people were asking how often people are getting one-on-one coaching. Is it a weekly basis, biweekly, some other time frame? And where do people receive their calls? Do they are they getting at home, at work? Is it their choice?
Yes, when the individual completes their health and wellbeing assessment, they will specify what time of day they would like to be called, and also what number they would like to be called on. So we would use the numbers and time that they'd given us. The service operates between 9 and 8 p.m., 9 and 8 p.m. local time. So yes, that's what happens. In terms of how frequently the calls are, that will very much be negotiated between the coach and the individual. But on average, calls are often every couple of weeks. And there's quite a lot of intense work done at the beginning of the coaching program, with calls staggered later on at the end of the program to monitor and follow progress. But generally, it's mutually agreed between the coach and in the initial stages, probably every couple of weeks.
Carol, and can you speak to how the coaching service is integrated with existing on-site coaching programs or other programs at a client site?
With regards to on-site services, we particularly offer biometric screening services, and they will be used to take basic metrics of people's health and well-being. That was actually part of the vielife Online product, which they can enter into vielife Online. So they would have had some time with a nurse initially that would have provided these biometric screening metrics. And so they would have had some support initially, and then they can go and enter it into the online programs. And a lot of the online programs have a coaching element to them and have the model of the theoretical model of behaviour change underpinning our programs.
Great, thank you. And if people would rather be coached by their own practitioner, for example, a doctor, a pharmacist, a nurse, can the employee opt out of the employer program and use those resources for their desired coach?
Yes, certainly they could. They could print their health and wellbeing assessment report. They could print off the targeted risk assessment reports and any library material that they have, and they can certainly go and discuss that with their own medical practitioner or coach. Yes.
I had a question about whether face-to-face coaching would produce even better results.
I think it can be equally helpful, and it might be that for some individuals they would prefer the face-to-face element, but I think often that's very difficult in terms of practicalities of making sure that people are in the right place to see a face-to-face person. I think the great advantage of telephonic support is that it can be at a time that's convenient to you with minimal travel, and so in a sense it means that the individual can give a greater commitment than to face-to-face coaching. So I think that it's not really talking about one being better than another. I think really that on the telephone it's very immediate, and people really build good working relationships with their coaches, and it makes it so much easier in terms of accessibility and time. Often people want to have a coaching call in the evening, and working between 9 and p.m. Means that we can really be flexible and work with people telephonically, whereas it might be prohibitive face to face.
And this is Catherine. I could just add there, that there is some research around this. So there was a really nice clinical trial that was a 3-arm trial that looked at telephonic health coaching versus face-to-face health coaching versus online coaching. And the study did show that the telephonic and face-to-face were equally as good as the other, and they're both better than the online alone. So I'm going to look for that citation right here, Karen, and hopefully I can cite that before we're done with today's call.
Great, thanks.
Mm-hmm.
We had a couple of questions about stress, which is something we had identified as certainly an emerging global health risk and a concern. Given that it's a mental struggle, how is that handled via coaching?
Would you like me to answer that one?
Yeah, could you speak to that, Carol?
I mean, I think with all the elements of coaching, whether it's nutrition or physical activity, what we will do is understand what stress means for the particular client, what their hopes are, what difficulties that it is they're facing. So we'll understand, coach will work with the individual to understand what stressful difficulties the individual's facing, and then from there look at what strategies they could put in place to help manage their stress more effectively. So it might be referring them to a targeted risk assessment for stress, or it might be that they need to focus on maybe ways that they can handle stressful situations more effectively.
Catherine, anything else?
I'm just going to jump in with the citation for that article I mentioned. So it's with the Annals of Internal Medicine, February 17th, 2009, and lead author is Digenio. It was called Comparison of Methods for Delivering a Lifestyle Modification Program for Obese Patients, a Randomized Trial.
Thank you for providing that, Catherine.
Mm-hmm. Sure.
I have some additional questions about the coaching process. And Catherine, perhaps you can answer this. How many coaching calls in general provide the most optimal results?
So I think we have a couple ways to look at this. Typically, protocols are delivered based on somebody's risk profile coming into the program. And so we do offer a level of support for somebody who has a grade for change, and that's the model that we've set up for our services. And then within those models, it really, it depends on a number of factors, but we do see, individuals who are completing more coaching sessions, they're doing better in the program. And, those are the individuals who are likely, very committed to the program. They're adhering to the plan they've co-created their health coach. And so, that we can take distributions to see where that tipping point really comes, what level's optimal. I know some research has shown that individuals who are completing 3 more telephonic coaching sessions using motivational interviewing are making change. In our programs, we do report out distribution of calls, and we like to see individuals completing at least 3 calls in a health coaching program. So, I think that if we can get 3 as a baseline, we're going to deliver some change over that program.
Okay, thank you, Catherine.
Mm-hmm.
Carol, I had a question. If this the global coaching solution, is it appropriate for a rollout on a more limited basis, for example, country by country? Do you see that among your client base?
Yes, and certainly that's sometimes how it works out, because it might be that you have a global strategy, but that you'd like to bring different countries online at different times. And I think in liaison with the actual in-country representative, you can decide when's going to be the most effective time. For example, it might be that if you're looking at China, you might not want to bring it on board when it's the Chinese New Year, which might be a perfectly fine time in the UK, for example. So it would be really useful, I think, to think what would be culturally appropriate for the country as well. And so, yes, I think to phase it out at different times would be really useful, because I think you also learn each time that you roll out a program in a territory. You get lots of learnings from that, which can then be transposed to a different territory.
Thank you, Carol. A couple questions about requirements and certifications for health coaches. Can you speak to that?
Yeah, like me to do that one, Karen?
If you could, please. Thanks, Carol.
Yeah, as Catherine mentioned earlier, because global wellness coaching is such a new field, there are no internationally recognised coaching qualifications. However, all of the coaches that we use are certified through certifications in their own country, and they will be registered in organisations within their own country. May also have additional qualifications such as being mental health practitioners or nutritionists, maybe have a health background or a nurse, as we talked about for Germany. So they all have a coaching qualification which is relevant to the country that they're working in, and they undertake a rigorous selection and recruitment process before they come on board to our international network. And I believe that there's a national consortium in the US that is looking to build some standards, and hopefully that will be rolled out globally in the future. We also ensure that our coaches receive internal training on our coaching model and processes, and also to ensure that they're familiar with the online product set and the programs that they can refer people onto, and relevant resources such as library articles, or if an organisation has got an employee assistance program, for example. And coaches will have to undergo continual professional development each year as well to maintain their accreditation and standards. And we also have internal audit processes and case management procedures to check quality and consistency.
Great, thank you, Carol. We had a question that, a lot of the discussion here has been around, of course, phone calls, and we had a bit of discussion around the value of face-to-face interaction. Do you do any online coaching, and if so, what does that model look like? And Catherine, maybe you could speak to that first.
Absolutely. And, just to follow up for one additional minute on qualifications of our coaches in the U.S., all our coaches have a 4-year degree in a health-related field. About 30% have master's degrees. 100% have received a nationally recognized certification in health coaching. And that's, from more than one organization. As Carol stated, there's not one credentialing body at this time. Some of our health coaches have received multiple certifications, so it's nationally recognized certification that could come from, a variety of organizations. And just to reinforce that there is one body working on now credentialing organization or, criteria that could go globally. So that's called the National Consortium for Credentialing Health and Wellness Coaches, if anyone's interested in that. So to go on to the next question, and remind me what that was, Karen.
It was about an online coaching model.
Absolutely.
Like.
Sure. So with the WebMD health coaching program, it starts with the health risk assessment, obviously, and that goes for vielife as well. And then what we use at WebMD is something, we have two options, really. We have some online modules related to risk categories where individuals can do some reading and some planning. Those are called lifestyle improvement programs. But where we're moving, we had past webinars on this topic, I know, is to a digital coaching program that we're calling the Digital Health Assistant. And we do have some live on that today, but it's meant to accompany our telephonic coaching program. And it really is a tool to help individuals set goals, both long and short term, track against those goals, understand, the very concrete, actionable steps that might be taken during the week to create a weekly plan of action for that user. And so that's what we put into place, and we're moving our coaching clients onto that application right now, and we will have a mobile version of that available this summer. So we're pretty excited about that. But yeah, it's a tool to accompany the work that they're doing with their telephonic coach. It could stand alone in a case where someone didn't have telephonic coaching available, maybe somebody at a low risk category, for example. So it's that's what we're using today. It's called the Digital Health Assistant.
Thank you, Catherine. We have time for just a couple more questions. Question for Carol. One of the participants asked if there's an opportunity prior to implementation to visit a coaching operations center in one of the larger countries where vielife offers coaching. Is that something that you are able to accommodate?
I know that will be something that we would be able to discuss and accommodate, yes.
Good to know. And we also had a question as to whether the health survey is the same that's used by both WebMD and vielife, so the health risk assessment.
So this is Catherine, and I know I was cutting out when I gave this answer last time, but really the reason why we've determined that vielife is a wonderful partner for us is just how our solutions really are mapped closely together. If you look at our coaching programs, the approach that we use, the technique we use, the protocols, the training, etc. They're not identical, but they are, very much in tandem. And I would say the same goes for the health risk assessment. They're not the same tool. So the vielife tool concentrates on, 4 key pillars of change, and that is then localized and translated for each of the countries where they are. So it's not identical, but I would say, that it is, again, they both have the same spirit. They're used to really identify the risks the individual has, reflect that back to the individual, and then refer that individual into the next, the coaching program.
Great. Thanks, Catherine. Carol, anything else to add on that?
No, just to add to one of Catherine's comments before about, we were talking about the online programs. vielife has got various lifestyle management programs that really have an online coaching structure to them, so that people will get weekly tasks and tasks to do and be able to monitor their progress. So in fact uses the whole coaching process but online.
Thank you, Carol. Well, that is all that we have time for today. So I'd like to thank our speakers, Carol and Catherine, for their time and their expertise. And I'd like to thank everyone who attended for your participation and all of your questions. Please note we'll receive an email with a link to a recorded archive of this webinar within the next couple of days. And if you'd like more information from WebMD or from vielife, you can reach us at the email address listed on the screen. And that concludes today's webinar.
Today's webinar may now disconnect.